Some issues that I've always found important is to do so-called cohort studies. The other issue is to do international collaboration. And maybe a third issue would be to look at what we call validation of exposure measurements in air pollution epidemiology, and I'll explain what that is to the audience. If I start with cohort studies, a cohort is a group of people that you approach as an investigator for participation in a study for a long time. So you start by asking people, do you want to participate in a study, and do you want to be followed for 10 years, 15 years, 20 years? And then we try to find out as much as possible from about these people as we can. We want to know their dietary habits, want to know their smoking habits, occupation if it's adults, where exactly they live, what kind of other habits they have, in order to be able to assess as accurately as possible what the effects of all these factors are on their health status. Then we try to look at groups of people living in different areas which have different exposure to air pollution, and then see whether, after we take into account all these differences in smoking, diet, you name it, whether there is a relationship between the different air pollution levels in the places where these people live and the health status as it develops over the course of a number of years. Obviously, these are difficult and expensive studies to do, because you have to stay at it for 10, 20, sometimes more years. But they're extremely valuable because you're looking at a group of people as they move through their lives in time, and you're able to look at differences in air pollution, not only in spatial contrast, but also in time. So they are extremely valuable studies. I've mentioned the word international collaboration here because each of these cohort studies all by themselves, even though they could be large, are often not large enough to give you the final answer to the question whether air pollution has an effect on mortality, heart disease, lung disease, etc. And there, if you can find similar cohorts in other places in your own country or in other countries in the world, and do studies using exactly the same approaches, exactly the same methods within these cohorts, then you can make the evidence base much stronger. And we've been fortunate in Europe to be able to do the so-called ESCAPE study, European study of cohorts for air pollution effects, where we combined the data from 35 different cohorts in many different parts of Europe, and we're able to look at the development of many different health endpoints, as we call them: heart disease, lung cancer, but also cognitive development in children, respiratory infections in children, mortality from heart disease, mortality from lung disease, and a bunch of other endpoints. And that has proven to be a very valuable experience, because in most of these cohorts, the effects in the cohorts individually were not big enough to be very convincing, but the combination of the evidence from the different cohorts gave us some very clear answers, for example, about the effect of air pollution on lung cancer in Europe. The third issue I mentioned is the what we call the validation of air pollution exposure measurements. We typically measure air pollution outdoors. We don't go indoors because it would be too difficult in a large cohort with thousands of subjects to measure their personal exposure or to measure the air pollution in the homes where they live and the places where they work. So it's important to have small-scale studies in which personal exposure measurements are carried out, indoor exposure measurements are carried out, that are then correlated with the outdoor concentrations that we use as the starting point in our epidemiology, our population studies. And we've been doing a bunch of those studies over the years, and we're generally able to show that what we measure outdoors is a good representation of what we measure in personal exposure or in indoor concentrations that people are exposed to for most of their daily lives.